Many traditional Chinese medicine practitioners begin their clinical education with an incomplete question: which element controls qi? Treating qi as a substance in a vessel, something to be passively refilled or drained, stalls treatments in chronic cases. The Huangdi Neijing defines qi as movement with purpose. It describes the primary reality that exists before organs, elements, or pathology appear. The 5 elements, or Wu Xing, describe how qi behaves once it differentiates. They categorize the specific ways qi acts within the system. These elements act as distinct functional authorities. Each governs a specific role: creation, anchoring, command, regulation, or transport. Precise diagnosis requires a shift in framing. Instead of asking which organ is affected, practitioners must identify what qi has failed to do. Understanding qi as a governed vector allows a practitioner to regulate internal functions rather than reacting to downstream symptoms. Consider a baseline state of uninfluenced qi, a single, continuous vector of energy moving through the body. Water, represented by the kidneys and jing, tethers the vector. It provides the root that holds qi within the body's lower burner. A loss of this anchorage causes qi to float upward. Clinically, this presents as dizziness, unsteadiness, or anxiety, symptoms of unstable qi rather than a lack of it. Earth, through the spleen and stomach, creates post-heaven qi, thickening the line of energy available to the system. Nutrients must undergo transformation to become qi. Earth provides the metabolic warmth and timing required for this conversion. When earth governance fails, production drops. Metabolism slows, leading to a dominant sensation of heaviness and fatigue. Wood, the authority of the liver, branches the flow. It ensures the free coursing and distribution of energy across every internal pathway. Wood is strictly an agent of transport. It spreads the qi that earth has already produced. A failure of wood causes a bottleneck. This lack of transport creates internal pressure, manifesting as physical rigidity and emotional stubbornness. This distinguishes the 2 primary causes of restricted energy. Fatigue stems from a production failure in earth, while rigidity stems from a transport failure in wood. Once qi is produced and moving, it requires higher-order governance to determine its direction and limits. The fire node, housing the shen, gives the vector coherence. It determines the appropriate placement of energy based on the body's immediate needs. Fire provides purpose. It ensures that qi is settled and ordered rather than scattered or chaotic. If fire fails to command, qi becomes displaced. This results in restless agitation and emotional volatility without an obvious external trigger. Metal, acting through the lung, enforces the boundaries of this movement. It regulates the rhythm of respiration and the specific limits of ascent and descent. A failure of metal causes qi to become diffuse or rebellious. Clinically, this loss of regulation manifests as indecision and a loss of direction. Fire sets the destination for the vector, while metal maintains the containment required for the energy to reach it. One specific clinical detail is often misunderstood: the relationship between fire and earth. Fire acts through the transitional state of heat. This heat provides the operational warmth that earth needs to function. This heat enables the transformation of food into qi. The full cycle flows from fire to heat, then through earth, metal, water, and wood. Digestive weakness is often a failure of this mediated heat, rather than an inherent defect in the spleen itself. Treating fire directly without addressing the heat cycle can worsen systemic symptoms by overstimulating the heart without supporting the spleen. Restoring warmth to earth is necessary to restore the downstream functions of metal and water. Translating this model into the treatment room requires selecting points that address these specific governance failures. We can map each failure mode to an upstream acupoint designed to restore that specific authority. To correct a failure of creation, we use spleen 3. As the yuan source point, it directly stimulates the spleen's core transformative capacity to produce qi. A failure of rooting is addressed via kidney 1. Positioned at the lowest point of the body, this point draws floating energy back down to the source. For a failure of command, we select pericardium 8. This fire point on the pericardium channel clears heat and settles the shen to restore order. A failure of regulation points to long 9. As the influential point of the vessels, it governs the pulse and the systemic rhythm of qi. A failure of transport is corrected at liver 1. As a Jingwell point, it initiates the outward spread of energy to resolve stagnation. Selecting points based on these functional roles provides a logical correction to the system's governance. This framework follows an operational protocol: contain the symptoms, regulate the authority, and restore the function. Correcting the failure upstream reduces the need for excessive needling and fundamentally prevents constitutional strain on the patient. Qi is created by earth, rooted by water, commanded by fire, regulated by metal, and transported by wood. Clinical mastery involves restoring internal governance. When qi performs its roles correctly, the environment required for disease is removed.